company, which has been around since 1970. We were the company that introduced smoke detectors in the US in 1970. Then we went into air filtration and water filtration. And then, by a divine connection between Dr. Smokey Centillo and the Juice Plus crew, Juice Plus was born. I'm not going to spend a lot of time on that, but simply put, Juice Plus is really good food that's easy to get because it's in capsules. Fruits, veggies, and berries that have been crushed into a powder, put into a capsule to help you level up your energy, level up your body, level up, get more fruits and veggies in your body. So I'm going to turn it over to Carla, and Carla's going to continue.
I'm sorry, I think we lost your sound. Okay, well, thank you so much. This is my buddy Ruthie, and I'm Coach Carla Joy, and I'm really glad that we're here together this evening. And one of the things that I'd like to do is try to share my screen while I talk to you a little bit about what we're going to do this evening. Um, so I've been on a journey to help people understand what's going on in their health journey. And um, if you have or know someone who has been suffering from heart disease, then I would like you to please put a 1 in the chat. So if you know someone who's been suffering from heart disease, then please put a 1 in the chat. Now, all of the information that I will be sharing with you this evening, I want you to think of it as education, um, and not to make any uh, changes to your medication or to some planned procedures without first having a discussion with your physician about what your concerns are and what you'd like to do instead. So as we go through this presentation, I'm going to start by telling you a little bit about my story. So several years ago, I realized that I wasn't feeling so well. And one of the things that I decided to do was to take off my white coat and go and sit in a doctor's office. And in that doctor's office, have you ever noticed how cold they are? Anyway, I was in that doctor's office waiting, and in comes my medical professional, my doctor, and she says, "Young lady, you have high blood pressure, high cholesterol, and prediabetes." Now, that scared me because I felt she had just given me evidence that I had won the bad genes lottery. Um, on another day, we'll talk about the impact that that conversation had on me. But right now, I want you to know that my father and my father's brother uh, and their sister all died from complications of cardiovascular disease. So, what we're talking about this evening is very, very personal to me. I really, really really feel the concern that some of you might be feeling if you have members of your family that are suffering from heart disease. But I want you to know you're not alone. These are some statistics that are a little dated, but it's expected that 1 in 4 people will die in the United States of heart disease. 1 in 2 women and 1 in 3 men will develop cancer. 1 in 3 will develop diabetes by 2050. And although that's a little way out, each projection really is a bit scary. And when you think about 1 in 5 of our kids being obese, here's what Dr. David Katz says. Our children are more harmed by poor diet than by exposure to drugs, alcohol, and tobacco combined. And that's scary. So this evening, we want to take a look, like almost an inventory of what's our situation. The toxins in our environment are increasing. So whether you look at the air, the water, the soil, or the sea, there's more pollution, more contaminants, more chemicals, more things that we use on land ending up in water. And if they end up in water, they're ending up in our livestock. And apart from that, the food that we're growing is actually decreasing. You know, in the 1940s and 50s, there was a huge move, a huge shift away from family farms to big agriculture, to the point that now in this new century, there are very few family farms. And yet, with all this expansion and technology, um, 50% of the food that we eat is processed and is filled with preservatives, growth hormones, pesticides, trans fats, and artificial colors. And even the fresh vegetables, things like broccoli, they lose a huge percent of their key nutrients before we purchase them. So each of us has been on a journey, I'm sure, to find solutions. And I'm here to tell you that we're grateful. Those of us who are on this call are grateful that we've partnered with a company that has the heart to inspire healthy living around the world. And we want to share how you can make a few simple changes. You know, one of my mentors, Dr. Pam Popper, says that this current medical environment makes you feel like a helpless victim, but we don't have to. She says, we don't have to. Your health is in your hands. And I hope that by the end of this presentation, you'll agree that there are things that you can do. Some of those things are actually listed on imaged on this picture here, and maybe you can pick up on some of them. But even as we go ahead, the number one cause of death and disability in this country is heart disease and cardiovascular disease and conditions associated with it. But did you know that there's some places on earth where these conditions, heart disease and all the others in that list of 15, they either are very, very low or don't occur at all? And Dan Buettner, in his book, The Blue Zones, he describes that there are places on Earth where people are living longer and they're living better and they're not suffering from as many of these diseases. One of those locations is actually in the United States, Loma Linda, California. Another is in Nicoya, Costa Rica. Another is in Sardinia, Italy. Icaria, Greece. Please forgive me if I mispronounce these words, and Okinawa, Japan. So if you have an idea and a desire to look into what what's the difference between these locations and locations where people like ourselves have a high risk of dying of heart disease, you could take a look at that book. And when we're talking about heart disease, when we're talking about cardiovascular disease, we want to know that the heart is only a part, a major part of a whole circulatory system. So if you can go back in your biology class, they told you about arteries that take blood from the heart to the all the other parts of the body, and veins that bring blood from the parts of the body back to the heart. Now, when you get to the different organs of the body and the tips of your fingers and tips of your toes, tips of your nose, there are in your skin, there are small vessels that connect the veins and the arteries. The arteries bring the blood, and the capillaries let the blood out into the tissue, and then the veins collect the fluid back and take it back to the heart. And what's in that fluid? So that fluid is blood, and there is a liquid component called plasma, and then there are cells, red blood cells and white blood cells. The red blood cells are involved in getting oxygen to our tissues and picking up the waste product carbon dioxide that has to be sent to the lungs so that we can breathe it out. And the white blood cells are all part of our immune system. So it's a whole circulatory system. It's all functioning beautifully, but something causes disease. And what is it? So, researchers over time have come to recognize there's something called inflammation. And there's a special kind of inflammation, and they call it atherosclerosis. Now, atherosclerosis is found in the major vessels, and it's really inflammation that can attack the arteries. So, this image up here shows an image of a normal functioning artery. The lining of the artery, the endothelium, is smooth. It's made up like of cells that are like pavement cells. They're all neatly packed together, tightly packed together. But the second image shows what happens when there's inflammation underneath the endothelium, and cholesterol, which is like spackle. You know, if you have a wall and it's damaged and you want to repair it, you can put spackle on it. Well, cholesterol is our internal spackle. It has many functions. It actually is part of cells to make them pliable so that they're not stiff, but it floats around in the blood and it acts as spackle when there's inflammation occurring. So it's trying to smooth things over. But in the process, it might take up all of this room. And you can see how a vessel can go from this size, where it's great and smooth and allowing a lot of blood through. And then it may have inflammation and less blood can flow through. Now, if you've ever kinked a hose, when you reduce the diameter or you reduce the size, the area of the space that the water comes through, what happens to that water? It squirts out harder. That's right. So there's a connection between high blood pressure and what's going on in the arteries. So just keep that in mind. When there's high blood pressure, it might be that the heart is working extra hard to push blood through some constricted arteries. So keep that in mind. So there are numerous things. I remember I told you there are blood vessels that go take blood from the heart, and there are blood vessels that bring blood back to the heart. Well, those blood vessels can get inflamed, and there are innumerable inflammatory conditions described. So I don't even want to start going down the list, but as you can see, there are many inflammatory conditions of the blood vessels. And some blood vessel conditions are called vasculitis. Now, wherever you see itis in the name of a condition, it's telling you that the medical professionals already know what's going on there is inflammation. So the letters that make up the term itis indicate that there's inflammation that's involved in this condition. And each of these diagrams shows you the kind of damage that can happen to blood vessels when inflammation is taking place. They can become reduced in size, and they can get completely blocked, or they can get so stretched that they balloon out and there's just blood just flowing in abnormal patterns. So that they're all different kinds of problems, vasculitis, inflammation problems that can happen in the tissues. Now, I told you that inflammation has a part. So maybe we could just get rid of inflammation. But hold on, hold on. let's understand what inflammation is in the first place. Inflammation is your body trying to heal itself. It's a healing process. So if I were to hit myself on the hand or scratch myself on the hand, you would expect to see, because it's happened to you, I'm sure, or someone you know, it will get red, swollen, feel hot, painful, and there might even be loss of mobility, loss of function. All of these are signs of acute inflammation. That's the body rushing in to help restore, repair a wound. The problem occurs when inflammation, it's supposed to come and then go. It's supposed to resolve. But if the attack, if the problem, if the situations that cause the inflammation are not dealt with, then the body continues in this inflammatory state, which we now describe as chronic inflammation. Think of it like our body is actually like a furnace. Inside of our cells, there are little organelles called mitochondria, and they are the powerhouses of the cell. And inside, there's actually a process that we could think of like burning. And if you have a fire, you'll probably notice that all fires have little sparks coming off. And so, in that burning process that's taking place in our cells, there are little sparks that are produced. We call them reactive oxygen species, and they cause something called stress. And we need to neutralize them. Now, if you had a fire, you'd put a grate in front of it to block the sparks and keep them from getting onto your rug and causing a fire. But these sparks that are in our body, they need to be neutralized with antioxidants. In fact, the chronic inflammation that comes when these reactive oxygen species or these inflammatory particles are not neutralized, this chronic inflammation is implicated in diabetes, neurological diseases, autoimmune diseases, arthritis, pulmonary diseases, Alzheimer's, cancer, and the one we're interested in tonight, cardiovascular disease. But you might be saying, well, okay, so what do we do? Well, there is a solution. And part of that solution, a big part of that solution, is our food. Whole foods, foods that are in their as close to natural state, whole foods are anti-inflammatory. They actually contain phytonutrients. Plant foods contain phytonutrients that neutralize the reactive oxygen species, that neutralize those sparks that create oxidative stress in our body. So, one of the things that we have to realize is that if food is important, then probably digestion is important. And you're right. And one of the things that we've come to learn over the past 20, maybe 30 years is that we have not known the value of our gut microbiome. Now, the digestive process starts in the mouth. Some people say that it actually starts in the nose because when you smell that food, it actually triggers the production of enzymes and hormones in your body in preparation for digestion. And then you take a bite of something and you chew it up. You're supposed to chew it until it becomes liquid. And then and as you do that, your saliva mixes enzymes into what you've eaten and it helps break it down. And so by the time you swallow it, it goes past your tonsils, which are immune cells, and they're just taking samples of whatever you just ate. And it goes down your esophagus into your stomach. You can see the stomach here. The stomach produces enzymes, and those enzymes, as the muscles of the stomach churn it up, mix it all up, and there's more digestion going on there, a lot of digestion of protein substances, and then it passes it from the stomach into the first part of the small intestine called the duodenum, and you get chemicals coming from the liver, the gallbladder, the pancreas, all poured in to also participate in the digestion of carbohydrates, fats, and proteins. And all of that is supposed to continue along in the small intestine and be absorbed into the blood system. See this, the dark gray here? That represents the blood supply that goes through the whole small intestine and ferries all those nutrients that have been broken down into their simplest components and ferries it to the liver. Now, by the time things get to the large intestine, um, most of the nutrients have been, we're told, have been absorbed, and mainly water is absorbed in the large intestine, and that continues along and is passed out as stool. Now, there is one nutrient that behaves differently, and that is fats. And you might be thinking, oh, okay, what does this have to do with cardiovascular disease? I'm so glad you asked. We were talking about how things are broken down in the mouth, in the stomach, in the small intestines, and fats are also broken down into tiny, tiny, tiny units, into their smallest units, and then they cross the gut-blood barrier, but they don't go directly into the blood. They go into something called lacteals. There's a special highway for fats that goes, bypasses the liver and goes straight to the blood circulation right underneath your collarbone. And what we have realized, as the researchers have done, is that these fats, especially if they are not the best fats, can pull in some toxins from bacteria from animal products. So sometimes when we eat animal products and we are eating a high fat meal, some of those fats pull those toxins from the animal products that they've not been damaged by heat. We might have cooked our meat very well. They're not been damaged by that, and those toxins get into the bloodstream. And so half an hour to an hour after a high fat meal, we have an inflammatory reaction. So the fats are inflammatory, but the toxins that they help get into the blood are also inflammatory. So let's take a look at some research that indicates the role of this process that I just described. I hope I haven't complicated it. I hope I've made it simple. But they did research at the University of Maryland, and they got three groups of people. Now, I don't know about you, but every time I eat broccoli, I can tell. Is that you? I mean, could you put a 2 in the chat if every time you eat broccoli, you can tell? Right. So if you want to give people food and you want to have a double-blind placebo-controlled test, the best thing would be to put the food in a capsule so they would know that they're eating broccoli, right? Okay, thumbs up. Okay, so for this experiment, they actually did that. They had fruits and vegetables in capsules, and they had a placebo group. So they thought that there was fruits and vegetables in the capsules they were taking. There was a fruits and vegetable group, and then there was a fruits and vegetables and berry group. Now, every one of them were given the opportunity to go. Everybody in those three groups went and had a high fat meal at a restaurant near to the school, fast food restaurant near to the school. And for each of them, you could see by the black lines that they all, sometime after eating that high fat meal, they all lost some of the reactivity of their arteries. Now, think of it. The heart pumps the blood. Remember, I said the heart pumps the blood into the arteries. The arteries expand and contract to move the blood further along. But after a high fat meal, that ability went down by 40%. And it happened in all the groups. But after about 4 weeks of taking the placebo or the fruits and vegetables or the fruits and vegetables and berries, they were able to determine that those who got the placebo, let's look at the white line, they still had a loss of almost 40% of their reactivity. Just like you and me, it happens to us when we eat a high fat meal. Those who were adding fruits and vegetables, they got the real fruits and vegetables, they only lost 15% of their reactivity. That's huge, a huge difference. And those who were taking the concentrated fruits, vegetables, and berries in the capsules, they only lost about 5% of the reactivity. The researchers called that statistically insignificant. In other words, in their minds, it was almost as if this third group had not eaten a high fat meal. And that's the power of food. So we know, number one, our food can be pro inflammatory. But we also know, so a high fat meal is pro inflammatory. But now we also know that adding fruits and vegetables and adding enough fruits and vegetables and berries can be anti inflammatory. Now, this picture shows you some of my heroes and heroines. And all of these medical doctors have participated in educating me and hundreds of thousands of others about just what I told you today, that there's inflammation that's happening in our bodies, and there's also inflammation that can happen from our food, especially a high fat meal, and that our fruits, vegetables, grains, peas, and beans can neutralize that inflammation. Now, although I would love to talk about all of the people here, especially the late, great John McDougall, one of my instructors, I'd like to focus on this image down here, which was shared in the work of Dr. Caldwell Esselstyn. What did Dr. Caldwell Esselstyn do? Well, in 1985, this was a long time ago. He enrolled 24 patients into a study. He went to his cardiology friends at Cleveland Clinic and he said, look, I believe that there's something we could do about heart disease. And they said, well, have at it. And he asked them to share with him some of their patients. So 24 of their patients were enrolled in his study. But what he found is that these patients were very, very, very ill. They had between them 49 cardiovascular events, and some of them had been sent home by their physicians, their cardiologists, to prepare to die. Um, After dietary intervention, their cholesterol was lowered. Remember, I told you about the spackle? Cholesterol can act like spackle on arteries. That was lowered from an average of 246 to below 150. Their exercise capacity increased, sexual function was restored. Erectile dysfunction in young men could be an early sign of cardiovascular disease. They had no further cardiovascular events. They needed no drugs and no procedures. These are people who were really, really ill. And he found that more recently, he worked with a larger group of 200 patients, and there was a 90% compliance rate. So this dietary intervention was not too hard. 90% of the people stuck with the program. And those that did, they had a 0.6 incidence rate. But those who dropped out, that 10%, they had a 62% incident rate. In fact, there was even, unfortunately, a death. Now, I want you to look at this diagram here. One of the doctors that knew Dr. Caldwell Esselstyn and knew about his program suffered a heart attack. And you can see the arteries from his angiograph right here on the left. And you could see what we call a flea bitten artery. But after eating whole food plant based under Dr. Caldwell Esselstyn's care, this is the same artery. Now, when I saw that, it was the turning point in my life. I told you that I had been diagnosed with high blood pressure, high cholesterol, and prediabetes. So I was a candidate for poor health and maybe even a heart attack. And like my father and my uncle and aunt. So when I saw this, I knew that I had found the 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 thing that I needed to follow to be able to change the outcome of my life. And now here is another component of the story: fiber, fiber, fiber. And where can we get our fiber? Only from plants. And you don't have to count your calories or count how much fiber is in each. If you will eat fruit, vegetables, whole grains, and legumes or peas and beans, you will get enough fiber to help your body stay healthy. Your body actually makes the cholesterol, and if you have enough fiber in your diet, the fiber traps the cholesterol that your liver pours into your gut and escorts it out like a policeman so that that can help lower your cholesterol. That's why fiber is so good. Now, I was wondering, maybe if we can persuade one of our people here, Miss Ruth, to tell us her story, because you've heard my story, you've heard what happened with Dr. Caldwell Esselstyn's patients, but there's someone here today who has a powerful story. And I wonder if we could persuade her to share her story today.
I would gladly share my story today. Thank you, Coach Carla, for allowing me to do so. I just want to say hello to everyone out there in YouTube land and all those that are on the call with us tonight. I I've known Coach Carla for over 30 years now, and she's just one of my best buddies. And for all those who don't know, I call her my personal Dr. Google. She is a wealth of great information based in science, based in truth. So that's why I love her. We were talking about heart disease tonight, and heart disease entered into my family many years ago when my father died with heart disease in 1966. They didn't have the research and the things that we have today, but in my family, heart disease runs rampant. In fact, heart disease had caught up to me for a few years. And when I was diagnosed back in 1997 with congestive heart failure, dilated congestive heart failure, bradycardia, and mitral valve prolapse. And I was scared out of my mind. I was scared because I didn't know, but I was also grateful at the same time because it took a long time for them to figure out what was going on with me. So I was grateful that I had an answer, that God gave me an answer. And when I had the answer, I was like, okay, so what are we going to do? And I had already started on this journey and I was on it, like eating better and doing what I thought I needed to do even prior to the diagnosis. But after the diagnosis, I took it up a notch or two or three or four or five. So when people sometimes say how hard it is, for me, it was harder to be sick than to eat healthy. You get to decide. You get to decide, do I want to turn this around? Do I want to stay on this path or choose your heart? And I've heard it from other people. And at the moment, the person who said it first, they wrote a poem about it called Choose Your Heart. Life is hard. Choose your heart. So I chose life. I chose fruits and vegetables. I chose just to keep on the path. And then I was getting better, but my heart still wasn't functioning normally. I was just below the normal line. And As you know, just below the normal line is like wearing a pair of shoes that's maybe a half a size too small. It's very uncomfortable. So being just below the line was uncomfortable for me because I was tired all the time, every day. It was just tired. So I just figured, okay, this is what it is. It is what it is. We're gonna do it this way, God. This is what we're doing. So when Carla was kind enough to introduce me to Juice Plus, I don't need that. I'm already doing this. I'm already eating fruits, veggies, drinking. I'm doing all this stuff. I don't need this stuff in capsules. However, when the doctor told me my cholesterol was not changing and he decided it was more to do with my DNA than my diet, I told him, hold on, I'll be back. And I called Carla and said, tell me about this Juice Plus stuff. And I decided to take it because Carla very brilliantly sent me a video of her. And she looked so good. I said, hey, whatever that girl's doing, and I'm not going to scream because I actually did scream. Whatever you're doing, Carla, I'm doing that. And I called her and I've been on this path ever since. And I just want you to know, in 90 days, when I went back to the doctor, my cholesterol was down 22 points. And in 1 year, my cholesterol was down 62 points. And the only change I made was Juice Plus. So, you know, I'm Juice Plus for life. But even better, on February 8th, 2018, the doctor told me that I had a normal functioning heart. My disease reversed using real food. So I just want to tell y'all, use real food. The significance of February 8th, 2018, that was my father's 100th birthday. And unfortunately, he wasn't here to celebrate it with us. But I'm grateful and I thank God for this Juice Bus community. I thank God for just healthy living overall. Back to you, Coach Carla.
Thank you so much. I wanted you guys to hear this real live person that I love so much. We used to actually, she was ahead of us on our health journey. We used to buy the juices she made because it was so good and so healthy. And we didn't know, I really didn't know. I mean, I knew she was on a healthy journey, but I really didn't know that there was this bounty of food that she was introducing us to. And, you know, discovering whole food plant based. What is it? Well, thank you so much, Ruthie, for sharing your story. That's when 90% of your calories come from plants. So you have 10% to eat other things, non plant things, but 90% should be plants. That's fruits, vegetables, grains, peas, and beans. It does not include dairy, and it's low in fat, and water is your main drink. Again, because of that fat component that allows the ferrying in of those toxins that create that inflammatory storm, we want to keep the fats low. And dairy contains fats, it contains proteins that are pro-inflammatory. So even if you're drinking low fat dairy products, they're still increasing the amount of dairy proteins, which are pro inflammatory. So there are things that we can do to be healthier. It's not just one thing that she did. She exercised, she slept, she managed her stress, she drank water, she used safer products, and she ate real food. And whether, no matter which medical professional you are focusing on or you're getting support from, they all agree that we need more fruits and vegetables, that good nutrition is going to make the difference. But for many of us, we need a little help. So, if there was something that could bridge the gap, that could help you get one step closer to what you now know you need to do, would you be open to hearing about it? Well, I'm glad you're here because very briefly, I'm going to tell you about something that has made the difference for us. It's called Juice Plus. It is 30 fruits, vegetables, and berries that have been grown in pristine soil conditions. We actually know our farmers, many of them are multi-generational, and they grow it until it is fully ripened, because there are some compounds that are not produced in fruits and vegetables until they're fully ripe. And that's when they pick it, and as soon as possible, they crush it or flash freeze it and crush it into powders that they then encapsulate in a plant-based capsule. So this is food. It's not multivitamins. It's not isolated, synthetic, concentrated nutrients. It is food. And it has a food label. It's non-GMO. It's vegan and kosher, and it doesn't contain any dairy products, or for those who are gluten sensitive, any gluten. And then we have a third party come in and batch test it. So we are confident, because of this testing by NSF, that there are no substances in the Juice Plus that aren't on the label. And there's nothing on the label or in the product that should not be there. It is the most researched nutraceutical product in the world. You can ask Siri. So this is just to give you a glimpse of the 10 fruits, 10 vegetables, 10 berries that you can find in the Juice Plus capsules. We also have an omega product, and this is very helpful for those of you who have heard that omegas are very powerful and beneficial for us. But many people are trying to get that from fish oils. Did you know that fish don't make omegas? They actually concentrate it from the algae that they eat. But it also means that they concentrate the toxins in the waters in which they're swimming. So we bypassed the middle fish and went straight to the plant sources, the algae and 5 other plant sources, so that we don't only have omega 3, but omega 3, 5, 6, 7, and 9 as they occur in nature. And we have them extracted in a plant based capsule, and they're not exposed to oxygen, so they don't degrade. They're not heated and they don't degrade. So, this is a wonderful way for you to get access to the heart, brain, joint, skin, and eye health that the research shows is associated with these omegas. And remember, the reason these omegas are so powerful is because they are anti-inflammatory. We also have our complete shakes. This I call fast food on the go. Some people use them as a meal replacement, but others recognize that they're more like a very healthy bridge snack. So they contain broccoli sprouts, radish sprouts, alfalfa, quinoa, amaranth, pea protein, rice protein. It is vegan, 13 grams of protein, 8 grams of fiber. It has a low glycemic index because you're getting the whole plant, the sprouts, the fiber is with it. So that does not allow for it to cause big spikes. And so this is a great way to have food on the go. I keep this in my car, and I mix it either with water or coconut water or a plant-based milk, so that I can have a very healthy meal while I'm out and keep me away from fast foods. Now, some people have asked, what's the difference between fruits and vegetables in capsules and vitamin pills? Well, there are several differences. If you want to take a screenshot of this image, these are isolated supplements. Dr. Mitra Ray compares it to the old black and white technology. It was the best we had 20, 30, 40 years ago. But now I don't know anybody who's going to go out and try to buy a black and white TV. Well, multivitamins were the best we had back then, but we now recognize that they have to have labels that say they're not safe for babies, children, or nursing mothers. They're not always bioavailable. Sometimes when they are bioavailable, they actually cause problems. They're not certified, and they may contain contaminants. They may be GMOs. They may contain wheat and gluten. Whereas the Juice Plus, as I told you, is fresh fruits and vegetables that have been concentrated. They have all of the phytonutrients working together in synergy. Now, I'm not suggesting that Juice Plus will treat or cure any condition. It's simply healthy plant-based nutrition. And what we've learned from the research of Dr. Caldwell Esselstyn and the Maryland School of Medicine study, that nutrition is what our body needs to heal the inflammation, the chronic inflammation that is um, part of what is underlying heart disease. So I mentioned before about the research. The Juice Plus is absorbed into the body. It reduces oxidative stress. Remember, we talked about that. It maintains healthy DNA, supports the immune system, supports healthy skin and gums, healthy lung function, and contributes to cardiovascular wellness. We went over that study. It supports a healthy inflammatory response, supports quality of life, supports healthy cholesterol, LDL, and triglyceride metabolism. So as you can see, we can actually revert from what we were experiencing, and maybe we can start a movement where we can become a blue zone because we are now doing some of the things that will help us live healthy and live long. So if you're serious, here are some of the things that you can do. You can have a healthy jump start to your eating. We have in our programs education, health ambassador opportunities. We have coaching programs. We have batch cooking events from sourdough to salad in a jar. But may I ask you a question? What have you got to lose? Reduce your risk of heart disease, cancer, diabetes, mental decline, autoimmune disease. And what have you got to gain? Healthy skin, nails, slow aging, increased vitality, pain-free days, and maybe even give your body what it needs to restore health. So as you're thinking about that, I want you to think about what I call the 6 pillars of health, the lifestyle changes that you can make. Of course, we want you to know about how nutrition can make a difference, but there are also other things that you can do. You can walk for half an hour every day, a leisurely walk, and you can also drink more water, 6 to 8 glasses of water a day. Sleep 8 hours a night. Reduce the amount of stress in your environment. You may just have to talk with somebody about some of your relationships, maybe reducing the stress in your job. Reduce environmental toxins. Some of the things we spray, some of the things we use for cleaning, they have a label, a warning label. Do not use in an enclosed environment. But what's your house? An enclosed environment. So there may be things that we can share with you, how you can use water and microfiber cloths to do the cleaning instead of some of the toxic chemicals that we use. And of course, whole food, plant-based eating. And we have a way that we can help you jumpstart this process. We're actually in the middle of our Shred 10. This is a free program where we help you jumpstart. We have 10 guidelines. We have group coaching, free e-resources, cookbooks, support, and fun. So we start at the first Monday of every month. So we've already started, but it's not too late for you to join us. Talk to the person who invited you. You can still order your supplies, join our Facebook group, and get your Shred 10 guide. Here is a QR code that you can use. So I'll give you a minute to, a few seconds to get out your phone and take a picture of this QR code so that you can join us in the Facebook group. I go live every day and I have Sweet Velda helping me posting recipes, posting inspiring information, and we even have Chef Karen Carlisle also posting in the group. So tons of information, and we're just really happy to support you on your journey. Where to from here? Are you ready to get started? Well, the person who invited you would be more than happy to walk you through which of these combinations will be best for you. And keep in mind that we do have a program where for every adult that gets started on this healthy living journey, a one kid eats fruits and vegetables free. And this is from ages 4 through ages 24. I mean, who does that? Well, our company does. The Juice Plus company does, because we're committed to inspiring healthy living around the world and making it happen, facilitating the process as well. And I don't want to forget those of you who are athletic, whether you're a serious athlete or just a weekend warrior. We also have the Juice Plus Perform for you that has more protein, but also has been shown by the research to improve muscle growth, energy production, mental performance, bone health, and muscle recovery. We have the Tower Garden, where you can start growing your own food in your home. I don't have pictures of my own tower, but I do have one too. And for those of you who, like me, experienced a crash at about 2 or 3 o'clock in the day, we have a new product called Luminate. It contains lion's mane, mushroom mycelium, ashwagandha, alpinia galanga, cordyceps, mushroom mycelium, sage, rhodiola, and coffee berry. And it is refreshing whether you drink it hot or cold. It helps us stay focused, stay calm, but also it helps with mental focus. So it's really an exciting time for those of you who are ready to jumpstart your healthy living journey. And as you can see, we're providing holistic support. So many of you are ready to order, and I'd like you to call the person who reached out to you. On some of you may want to partner with us on our healthy living journey, and some of you might be interested in finding out about an opportunity about how you can make a little extra income. Either way, speak to the person who invited you and let them know that you want the free coaching, the Jumpstart program, the fruits and vegetables, and the complete shakes and the omegas and the tower. You want it all. And you can schedule using the Calendly link that's down on the in the bottom. So um, I hope that this time together has given you hope if you know of someone who is suffering from heart disease. You know, it is really life changing when you think about the fact that so many of us know people who are suffering from health conditions and who um, heart disease and who can actually have a better life. So I hope that the time we've spent together is really helpful to you, and that you will make a decision today about what you are going to do. So let me see if I can stop sharing my screen, or did I share my screen? Okay, maybe I didn't.
You did.
Okay, I don't know how to stop sharing it.
There's not a little button that says stop share.
It's the button says share.
No,
So
it's up top somewhere where it says stop.
yes, yeah.
I'm gonna stop the recording.
Okay, thank you. Well, if there's anyone here who would like to ask questions, that this is your cue to do so, and I would be happy to answer them for you.
Let me see if I can
Can you stop sharing for me, or
find. Now I can stop share mine. How do I?
yay,
Hey,
it
we are
worked.
still live on YouTube though. So
Okay,
okay.